Okay, hi everybody. Thank you for joining me today for the first live stream webinar from Central CPD. My name's Claire Walford. I am a head nurse and Anderson Ward's veterinary specialist, and I work for Synergy CPD, bringing training into practices, teaching anaesthesia, and I have my VTS in anaesthesia and analgesia, which means I'm a veterinary technician specialist. So first lecture of the day is advanced anaesthetic monitoring. So we go started. Yeah. Okay, so we're going to go through spirometry, capnography, pulse oximetry, blood pressure and ECGs. So starting off with capnography. So your capnograph is going to measure your end tidal CO2. It's going to give you a number in the form of millimeters of mercury, and if you have a capnograph, then it will give you a nice waveform that will tell you lots of things about your patient. So a bit of physiology. So your patient will breathe in, you'll get oxygen in, that goes off to your heart, which sends it off to your body. You will then have your body metabolize oxygen, produce energy. The waste product is carbon dioxide. That goes back to your heart, back to your lungs. You breathe it out and it will show up on your capnograph. So the capnogram has many phases, so 4 phases. So the inspiratory baseline, so when your patient breathes in, your capnograph should reach the baseline and should read 0. Your expiratory upstroke, so as your patient starts to breathe out, you have gases from your trachea and your bronchs, and as it comes out, your upper areas of your lung. Phase 3 is your plateau, so hopefully you should have just a nice straight plateau, a little bit of a slope on it, and that's air that's come purely from your alveoli. And then your expiratory downstroke, as your patient breathes in again, hopefully all that CO2 will disappear and it will go back down to your baseline. So we have our phase 1, patient breathing in. Phase 2 is the beginning of them breathing out. Phase 3, your nice plateau, and your phase 4 is they take another breath in. So a little video here. So hopefully you can see my video here. So the capnograph, as they're breathing in, breathing out, breathing in, breathing out. So hopefully you should get a shape on your capnograph that looks like a line of little elephants following one after the other. Nice and smooth and regular breathing. Always hitting the baseline when they breathe in. So your normal CO2 should be between 35 and 45. If it's high, that's hypercapnia. If it's low, that's going to be hypocapnia. So hypercapnia, so that's hypoventilation, so you're not breathing in enough. Your CO2 will build up because you're not getting rid of it. So a mild rise is 45 to about 59, 60. That might help you a little bit with your anaesthetic, so that will be your sympathetic nervous system stimulated a bit, maybe a bit of increase in heart rate. And then when you get to 60, it kind of drops over the other side and you start to get the bad side effects. So you can get cardiac depression, vasodilation, hypotension, and worst case scenario, central nervous system depression. The causes of hypercapnia. Number 1 is your deep anaesthesia. That is the number 1 cause under anaesthesia. They're just not breathing in enough because they're too deep and you've kind of depressed their respiratory system too far.